Hello, and thank you for joining us for today's virtual education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled An Introduction to Chinese Medicine. Before we begin, if this is your first time joining us, CSC South Bay's mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community so that no one faces cancer alone. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Educational programs are open to all. If you'd like to hear more about our services or join a community, please visit our website at cscsouthbay.org. Without further ado, I'll introduce our workshop speaker. Dr. Painovich has practiced traditional Chinese medicine, TCM, for over 24 years, has treated a multitude of health issues, and is passionate about educating individuals on the benefits that TCM can provide when integrated into their healthcare journey. Thank you so much for being here with us today.
All right. Thank you for having me. Okay, so like she said, I've been doing this now for, over 24 years, which is amazing. And I love what I do. I'm passionate about what I do. And any chance I get to be able to educate people in what Chinese medicine can do for your health journey, I'm always, up for that. And so today specifically, we're going to talk about traditional Chinese medicine, how it can aid in cancer survivorship, and also the side effects that you may or may not be, feeling from treatments that you're going through. If you have any other questions outside of here too, at the end, feel free to ask me about that, because there's really nothing that we can't treat. So if you have other stuff going on, I'm always welcome to answer that question as well. All right. So let's just begin by talking about traditional Chinese medicine. What is it? Well, it really is the oldest medicine known to humankind. We have texts dating back as far as 2800 BC. If you really talk about what archaeology has found, it thinks that this medicine's probably 8,000 to 10,000 years old. So given that fact, it's really pretty safe to say that the practice of TCM has withstood the test of time and only continues to gain in popularity. I can tell you, when I first started practicing, people are kind of like, what's acupuncture? And now when they find out, what I do, they're always like, oh, can it help this? And can it help that? And, one thing I think we all can agree on is that most medicines, right, it's always the newest, greatest, latest thing. But acupuncture has stayed stable. We practice it today like they practiced it thousands of years ago, because we know it works. And we continue just to use what they've taught us for, thousands of years. The aim, right, of TCM is always to prevent and or heal disease by restoring balance, because we think if your body's balanced, you're able to heal yourself pretty darn well. And so that's always our goal, is to get your body as balanced as possible. Chinese medicine is actually a very complex system with terms, crazy terms, right? Yin, yang, qi, meridians, excess, deficiency, stagnation, all these crazy terms that I usually don't talk about, because when I do, people, look at me like a deer in headlights. And so I do try and keep it more on the Western side, but hopefully tonight I'll be able to explain it to you in some simplicity, just to give you an overall kind of understanding of how it is that we practice our medicine. The terms that I'm going to talk about tonight are the ones that I think most people hear out in the population, things like yin and yang. Yes, it's pronounced yang, but you can say yang, it's potato, potato. So yin and yang, meridians, and qi. So yin and yang really are, just in the broadest sense, they represent our belief in the balance of opposites in life. So they are these life forces that are opposite, yet they're interconnected. And they're self-perpetuating cycles, and they cannot survive alone. In fact, death in Chinese medicine is when this black part of the white ceases to exist, and likewise the white comes out of the black. And so yin and yang are no longer interconnected, and the body starts to separate, and that's kind of when death ensues. So that's our philosophy, is that these have to stay interconnected in order for us to continue on our life path, and they need to be balanced in order to be as healthy as possible. So again, these concepts, right, different things, they represent different things in our life. Like yin is much more the nurturing aspect of our life. So you think about earth, where things grow, and femaleness, like in the growth of other human beings, darkness, passivity, those are all representative words that kind of tell you what our philosophy on yin looks like. Yang, on the other hand, is the energy in our life. So it's more the universal energy, sun, light, right? Maleness, activity. But if you think about this, right? Earth would cease to exist if we didn't have that universal energy that keeps us where we belong. And if we don't have both male and female to continue reproduction, right? We as a population would cease to exist. So that's what we kind of mean. They're opposite, yet interconnected and interdependent. So the TCM meridian system, this is really what drives our philosophy and our diagnostic criteria. So we believe that there are these meridian systems that it's composed of several channels that carry the chi, which is what we call our life force, our energy throughout the body. They also transport blood and body fluids, so throughout the entire body. And this meridian system, again, is what drives our diagnostic criteria. So if there's an imbalance in any of these meridians, which there are 14 in the body, so if any of them get out of balance, then they'll cause problems both in front of that particular meridian and behind it. It's kind of like a traffic jam on the 405, right? Somebody gets in a car accident and then all the traffic behind it gets all congested and nothing moves right. But then in front of it, right, the freeway is open and there's nothing moving. Well, in Chinese medicine, you're going to find that there are problems both behind the traffic jam with that congestion, and then forward with the part of the body that's not getting nourished because that energy is stuck. Different symptoms will pop up if one meridian is saying deficient and the other one's stagnated. Different symptoms will pop up, and that compilation of symptoms is what tells us what's going on in your body. And it's the individual presenting symptoms that lead us to diagnose your particular imbalance, right? And your treatment. So the thing I love about my medicine is that no two people are alike. So you can say I have 5 different people who have breast cancer. They all have that same diagnosis, but how they present to me is different in each case, and therefore I treat each person differently, right? And it's very individualized, and that's why it's so good at what it does. And again, right, the ultimate treatment goal is to be able to balance out this meridian system, because if it's balanced, your life is pretty darn healthy. Now, we have different modalities within the practice of Chinese medicine. What I'm going to focus on tonight are acupuncture and Chinese herbs, because that is what we do 95% of the time. We also do things like moxibustion and cupping and tuina, but we don't do that very much. And so I'm not going to spend any time talking about that tonight. So what is acupuncture? I think a lot of people know what acupuncture is, right? It's the insertion of very fine needles into points along those meridians that I just talked about. And what we're trying to do is manipulate the energy in those meridians, right, to balance that out. According to the World Health Organization, there are over 400 acupuncture points on the body. Do we use them all? No, I'd say probably 60, 70, 80 of those are what I like to call the big daddy points that we use over and over again that give us the most significant results. Research has proven time and again that acupuncture is effective in treating a plethora of health issues, from physical body ailments to emotional and mental health, and also improving immunity. I've personally been involved in research in my career. I've published research looking at the effectiveness of acupuncture in treating high blood pressure, hot flashes, coronary artery disease. I've spent some time in the emergency department and also trying to reduce length of stay for people in the hospital. So this is what I'm going to tell you about acupuncture research. In order to get funded, we have to do research that fits into the gold standard of Western medicine, which means we have to treat every person we see with the same protocol, right? So if someone's coming in with anxiety, we give them the exact same, say 10 or 12 needle protocol, which is really not how we practice, right? It would be different in reality. So when you see research that shows effectiveness in treating the same protocol with each patient, that's actually really good, because if we can get those effects kind of doing this blanket treatment, just imagine what we can get when we actually can individualize it to each person that walks into our office. So again, just kind of keep that in mind. I think that The effects of acupuncture are much greater than what the research actually shows. So let's talk a little bit specifically about acupuncture research for both the side effects of cancer interventions, as well as what it can do to prevent reoccurrence. So, common side effects specific to various cancer interventions include things like fatigue, your chronic pain, peripheral neuropathy, vomiting, nausea, digestive issues, hot flashes, anemias, reduced immunity, right? That's what we see a lot of times with these various interventions. So let's talk a little bit about what acupuncture has been shown to do specifically for cancer survivors' issues, like, for instance, chronic pain. One of the largest studies that has been done to date actually showed that there are two different types of acupuncture can reduce survivors' chronic pain. They found that both using electroacupuncture, which is just when we stick needles in your body, we put this little machine on them that kind of vibrates the needles a little bit. So they found that as well as just using acupuncture on the ear can significantly reduce people's chronic pain. And this is compared to people that use medication for pain or don't use medication for pain, which is huge. And what I found really in my clinical practice is that if you're on medication and you come in for acupuncture, it usually does enhance the effects of medication. So it makes it work even better. Or, if your goal is to get off the medication, we can do that as well. So the research for other cancer side effects, right? So the strongest evidence, and this has been looked at for years and years, is the effect of acupuncture on nausea and vomiting. It works incredibly well. I can tell you it works incredibly well, whether it's from chemotherapy treatments or, nausea from other medications, whether you're pregnant. It is really, really good for treating any type of nausea and vomiting. Other trials that are out there, right, they also report that acupuncture can help in reducing your fatigue, helps with both anxiety and depression, can help you sleep better. If you have dry mouth, it helps with that. And just overall, it improves the quality of life when compared to just standard care. So when you use acupuncture compared to people who don't, you do better. And that's what the combination of all those research trials show. Let's talk a little bit about what it could do for immunity, right? Because it's so important, especially if you're battling cancer, to make sure that your immune system is, working as well as it can. So there's been lots of research presented by lots of different authors. And what they really are showing is that acupuncture works really well for reducing inflammation and enhancing your immune system. And the reason that reducing inflammation is so important is because we now really know that chronic inflammation really is the underlying mechanism in all kinds of chronic diseases, and especially including cancer, right? And so it's this anti-inflammatory effect that acupuncture has that is most likely the key to reducing chronic diseases and enhancing your immune system. So when you have chronic inflammation, it dampens your immune system a lot, and that is just not good when you're trying to obviously fight off cancer or any type of chronic disease. The good thing is acupuncture has been shown to regulate both your innate immune system and your adaptive immune system. So we have lots of different ways to battle diseases and problems in the body. And it's been shown that acupuncture can actually help all of these different types of immune systems in the body. Well, how does sticking needles in your body do this, right? I mean, it's pretty crazy to think that you can stick some little needles in your body and you get all these results. Well, what they found is that when you put needles in the body, it is like the ripple effect. Like you get these incredible systemic changes that occur throughout the entire body. What they found, right, is that acupuncture, the regulatory effect of acupuncture on the body, like I said, it acts on multiple systems simultaneously, such as the regulation of what's called the neuroendocrine immune response, better known as NEI network, right? So all these networks, your nervous system, your hormone system, your immune system, all of this stuff gets elicited when you put the needles in, right? It gets affected, it works better. And this particular system, right, they actually all coordinate within each other and they form this internal organic network, which really is the biological basis for maintaining your body's homeostasis. So remember when I talked about how Chinese medicine is all based on balance. And if we can balance you out, your body is going to be able to heal itself really, really well. So what they're finding with research is when you put the needles in, that's exactly what's happening, is that it's affecting all these different really powerful systems at the same time and really getting your body in a nice balance. And like I said, when your body's balanced and working well, it is able to heal and, make sure that things don't attack you that you don't want attacking you. So let's talk about the other elephant in the room, right? As soon as you hear the word cancer and you've been diagnosed with cancer, right? Unless you're Buddha or the Dalai Lama, it's going to cause some stress and anxiety, without a doubt. So what does TCM and specifically acupuncture, do for stress and anxiety? A whole lot, right? And again, I'm going to talk a little bit about the research because I think it's important that I'm just not saying, yeah, it works, right? I want you to know that research also tells you that it works really well on anxiety and depression. So it works well, whether it's cancer-related anxiety and depression. So they've found through research that, if patients are suffering from anxiety and depression because of their cancer, it helps alleviate it. There's also research out there that shows, and this is when I talk about a meta-analysis, that takes all the research that's out there and kind of combines it and gives us one big report. So two recent non-cancer related meta-analyses showed that acupuncture is very effective for treating anxiety. One large study found that acupuncture had a large effect on reducing anxiety and depression. And this is important compared to conventional treatment, whether you're on medication for it or you're on psychotherapy. In fact, these results have showed that acupuncture is over twice as effective as either one of those. And I can tell you, again, in my clinical practice, acupuncture is so good at treating mental health. Like, it is amazing. Again, if you're on medication and you get acupuncture, oftentimes it enhances the positive effects of the medication. Or if you're on the medication and you really don't want to be on it, usually we can work towards that too, and oftentimes get you off the pharmaceuticals. We do it slowly and with your doctor's, approval, but we can actually make that happen. It is really, really good for treating anxiety and depression. And why is that important? Well, because if you're suffering from anxiety or depression, it has a negative impact on your immune system, right? So again, we kind of know through research that anxiety and depression lead to immune system impairment, and therefore, right, to treat it is going to help restore your immune response. So one recent study, very interesting study, looked at the effect of acupuncture treatment on immune function impairment found in anxious women. Don't know why it didn't include men, sorry guys, but it works just as well for you. And what they found is that after one treatment, right, about 72 hours after just one treatment, they found that it had a positive impact on your immune system. And then when they were done with the study, which I think it was a 10 treatment protocol. So once they were done with those 10 treatments and they test the immune system again a month later, those results were still intact. And I can tell you, when I see people and we get your original problem resolved, I usually do recommend that people come once a month as a maintenance, just because getting those acupuncture treatments once a month, again, and keeping that, balance of all those different important systems in your body, if you get a treatment once a month, it really does help keep your health at that next level. Okay, so let's talk a little bit about Chinese herbal medicine. So in order to talk about herbal medicine, I really need to take a step back and talk about the history of herbal medicine. So the oldest records of medicinal preparations made from plants, animals, minerals, those are of early Chinese descent, all the way back to the 28th century BC from an emperor by the name of Shen Nong. Pharmaceuticals, on the other hand, only markedly improved in the 16th and 17th centuries. So if you do the math, right, Chinese medicinals have been used for 4,400 years prior to the advent of pharmaceuticals. So we've had lots of time to practice, lots of time to figure out what works best with each other and all that stuff. The World Health Organization also actually estimates that 80% of people in the world use traditional remedies instead of modern pharmaceuticals, and for lots of reasons. But one, because they prefer them, because oftentimes they don't have the same side effects, or unfortunately, because pharmaceuticals are really too expensive or difficult to get. So really, a large majority of our population still relies on just herbal remedies, natural herbal remedies to, deal with all of their health issues. And actually, a full 40% of drugs behind the pharmacist counter in the Western world are derived from plants that people have used for centuries, including the top 20 best-selling prescription drugs in the United States today. So, and although many medicines have been produced from plant extracts, chemists sometimes find that the synthetic version, they don't carry the same therapeutic effects or may have negative side effects. And when they don't have those same effects when you're using the whole plant source. So the problem is that when you use a natural substance, you cannot patent that natural substance unless you break it down and find the one chemical that works. And then if they can find that, then they can patent that one chemical. They can make it stronger and they can give it to you as a pharmaceutical. But a lot of times when you take it out of its natural form, it causes lots of side effects. It doesn't work as well and that type of thing. So unfortunately, Chinese herbs will never be researched the way that they should be researched because there's no money to be made. So we can't, become billionaires off of Chinese herbal medicine. I mean, unfortunately for me. But so that's why they don't study them. And then also we never hardly ever use herbs individually. We always put them in an herbal formula. And it's just the composition is just too complex for research to figure out what's doing what. So again, the research on herbs just really isn't out there like it is on acupuncture. So let's talk specifically about what I do, the Chinese herbal medicine that I practice. So we have over 1,000 individual Chinese herbs in our pharmacopoeia. As I said, Chinese herbs are most exclusively taken in a multi-herb formula to ensure that they're balanced. And we like to treat ailments from various ways, right? So there's lots of different ways to treat something. And so we know that there are a combination of herbs that can help strengthen if there's a weakness in your body and can help kind of move out that energetic stagnation that I talk about. And so when we put these all together, they can hit whatever ails you different avenues. And then there's also herbs that we often put in there just to harmonize the whole formula to make sure that there are no side effects. And Chinese herbs are extremely safe when prescribed by a licensed practitioner and rarely interact with Western pharmaceuticals. And again, like the acupuncture treatments, Chinese herbal formulas are individualized according to your health needs. So when you come in and tell me what's going on, your list of symptoms will then guide me to, okay, this formula is going to be best for you, that formula is going to be best for your neighbor, and that type of thing. And again, because it's individualized, it tends to work really, really well. So people say, well, can you talk to me about anti-cancer herbs? Well, yes and no, because this book on the right, and these are old and tattered. I've had them for like 27 years, right? But I don't need new ones because our herbs don't change and the way that we use them doesn't change. So I use the same books that I got in school. And this book right here on the right, this thick book is all of the individual herbs that we use. And do some of them have anti-cancer properties? They absolutely do. But again, we rarely ever give you a single herb to treat something because oftentimes they work better in a group of herbs. And so we take all the single herbs on this right side right here, and then we make formulas that are all listed in this book over here on the left side, which gives me another like 800 or 900 choices of herbal formulas with which to treat. So it's really hard. Like I can't really talk about specific herbs and I can't really talk about specific formulas because they're specific to your needs and everybody's different. Do they have anti-cancer properties? Can they help you? Absolutely. Is it hard for me to talk about them individually? It is, just because of the way that the medicine's practiced. The other thing that I want to stress here, right, is that herbs are just one part of the answer. The origins and prevention of reoccurrence in cancer are multifactorial, right? So many different things can lead to the onset of cancer. Things like chronic inflammation, which I talked about before, right? That is the underlying aspect of so many chronic problems. So chronic inflammation, your gut health, different growth factors in your body, your insulin levels, your genetics, which play about 10% of increased risk in cancer. And then your epigenetics, right? What do you do outside of the genetics? What are your lifestyle habits? All of those things really impact, whether, you can stop the growth of cancer, you can prevent the reoccurrence, all of those things are important. So I can't just say, listen, take this herbal formula and you're good to go, because taking herbs can never override unhealthy lifestyles. And I want to make sure that you know that. But the thing that I can tell you, right, is that Chinese herbs can absolutely help give you a best fighting chance. And the reason being is because 70 to 80% of your immune system is in your gut. Chronic inflammation, and I keep talking about chronic inflammation. And by the way, if you want to get deep into this, you can go to my website, and I think under services, there's a list of other recordings that I've done, and there's one specifically on cancer and chronic inflammation and how that leads to. So if you want to dive deep into that, you can go to my website and look at that. But here, I just want to touch on that chronic inflammation, right? It starts in your gut, because 70 to 80% of your immune system is in your gut. And I have said for years, and I will say until my dying day, that when it comes to gut health, there is nothing better than Chinese herbs. It is amazing for helping whatever ails your gut. And if you're that person that says, well, yeah, I have acid reflux, but when I take omeprazole or Pepcid, then my symptoms are gone. So my gut is healthy. No, it's not. When I talk about gut health, that means that your gut, without medication interventions, when you eat, you just digest. You don't get bloated. You don't get gassy. You don't get reflux. You don't have diarrhea. You don't have constipation. If you have any of those things, right, that means that your gut is not as healthy as it can be, and therefore your immune system is not as healthy as it can be. So we got to get your gut better, all right? But Chinese herbal formulas are also great at other risk factors, right? They help reduce stress. They help reduce anxiety and depression. They're great for treating insomnia. So again, we have been using Chinese herbs for thousands of years, and the same things that bother us today from a health perspective bothered people thousands of years ago, whether it was kidney stones or gallstones or insomnia or infertility, right? We had to learn how to treat all of that with whatever the earth provided us. And that is what we've done for thousands of years, and what we can still do today with our Chinese herbal formulas. So there's not a lot that we can't treat with that. So if you have health issues, I would say, why not give it a try? So let's talk about herbs that treat side effects specific to cancer or cancer interventions, right? All the things we talked about before, that list of common side effects. Chinese herbs, again, yes, they can help treat all of this. And people might say, oh, right, sure it can, but right, they try and treat or give you pharmaceuticals to treat all these things, right? It's the same thing. My Chinese herbs I use just like Western medicine uses pharmaceuticals. So can I help you with this? Can the Chinese herbs work for this? Yes, they can. I want to talk a little bit about the safety of Chinese herbs, because so many people are afraid to take them. And there are a lot of Chinese herbal companies. I order from probably 2 or 3 because I want to make sure that their safety protocols are top notch. And the company that I most often order from, they all follow the standards of good manufacturing practice, right? That's established by the Food and Drug Administration and the World Health Organization. They make sure that they have what's called seed to shelf consciousness, means that they maintain accountability from the seeds through the planting process, the maturation, harvesting, processing, and testing. In fact, they actually have increased standards of quality control, because they actually look at each heavy metal and not just a total. What a lot of suppliers and companies can do is they can say, well, oh, my total of heavy metals is under what the FDA said was okay, but it may be really, like, say, heavy in arsenic, but low in lead. And you don't want that much arsenic or, any of these in anything that you take. And so the company that I use makes sure that each heavy metal is really at its lowest level. And they also provide something called a certificate analysis, which means at any time I can go in and say, hey, show me the COA of this herb or this formula or whatever. So that's always available as well. The other thing I always tell people is, if you're worried about what the herbs are going to do to, say, your liver or your kidney, what I say is go get some blood work done and get your starting liver and kidney functions checked. Go on the herbs for 2 or 3 months, and then go back and get your labs checked again. And that will give you kind of the reassurance that you might need to say, yeah, it's not going to affect your liver or your kidney. And I can tell you that they rarely, if ever, do. But again, if that's something you're worried about, right? Because we don't want to be stressed and we don't want to be anxious. So if that's something that makes you feel better, then I say go do that. If you're worried about what it might do to, your organs. So in conclusion, now, a lot of the major cancer hospitals that you hear, the big name people like Memorial Sloan Kettering, MD Anderson, Dana-Farber, even CHOC now, right? They've all incorporated acupuncture into their integrative approach to cancer treatments because they know it really helps their patients. The thing that I love about my medicine, right, is that we can treat you. So concurrently, we can treat your problem, but we also can prevent future problems, because when we make you better, we automatically make your immune system better, right? And we balance out the body, then the body's really able to stave off all of those, toxins and everything that's trying to get into your body and wreak havoc. Because of the multi-level effect on the body, TCM can ease symptom burden, right? Re-engage the immune system, like I just said, all at the same time. The good thing is that the treatments usually work pretty quickly. And again, they're all individualized to your needs. And that's why it works so well, is because I'm going to treat what you're presenting with, not just your overall diagnosis. That's not how we work. We don't treat you from lab results. We don't treat you from a diagnosis. We treat you from your symptoms that you walk in with, and according to how our meridian system, what it tells us is going on in your body. The other thing is it can't hurt to try, right? I mean, I can bruise you with an acupuncture needle, and that doesn't happen very often. I mean, yeah, I guess I could puncture a lung or puncture your heart sac, but I'd have to really try and push those needles in quite far, and that just doesn't happen, right? And the other thing that I wanted to say is that all the research that I discussed, remember, that was really on the effects of acupuncture and not on TCM as a whole, right? When we use acupuncture and Chinese herbs together. I didn't even touch on that from a research standpoint because the research is not out there. But I can tell you, when you put them together, this is what happens, right? It is like a fireworks go off in your body, and the health benefits and the way it can make you feel are amazing. All right, so hopefully you got that from the talk tonight. Hopefully I answered some of your questions, and would love to open it up for questions.
Thank you so much, Dr. Painovich. I did put into the chat the website, or the link to your website for the videos when you
Okay.
mentioned about that. And the first question that we have is, do you treat many migraines successfully?
I do. I absolutely do. Yeah, I've treated migraines. I mean, acupuncture kind of got known for its ability to treat chronic pain because Western medicine wasn't very good at that. And so migraines happen to be one of those things that oftentimes are not treated very well from a Western medical standpoint. So yeah, I treat them all the time.
Great. Is it with acupuncture or the herbs or another protocol?
Most often it's a combination.
Okay.
When it comes to pain, like say it's back pain or other chronic pain, oftentimes I just use the needles, but if it's anything outside of like a musculoskeletal or nerve pain, I will use both acupuncture and herbs.
Thank you. Can you talk a little bit about possibility of coverage of insurance? And secondly, how much the treatments for acupuncture or Chinese herbal medicines would cost on average?
Yeah, so insurance, I'm not in network with anybody, but there are PPOs that do cover it. Medicare, unfortunately, unless I'm an MD, I can't bill for Medicare when I do acupuncture. And they say they only cover for low back pain. It's like this little game they play. There is a particular Medicare coverage called Medicare Advantage. So if people have a Medicare Advantage PPO program policy, oftentimes it actually does cover acupuncture. If people don't have acupuncture, the rates are different. If you're under 65, the initial evaluation is 150 and it's 85 for follow-ups. If you're over 65, it's 125 for the initial and then 75 for follow-ups. The herbal formulas usually run about anywhere from $20 to $30 a bottle, and a bottle usually lasts you 2 to 3 weeks. So we're talking 50, 60 bucks a month, usually at the most for herbs.
Thank you. Next question. Can acupuncture and or herbs help with egg retrieval? Currently about to undergo this for fertility preservation before chemo.
Yes, in fact, it's very good with that. And there is, oh my gosh, my brain. There is I was trying to think of the website. I'll have to get it to you, but there are acupuncturists who specialize in infertility treatment, and that's all they do. I recommend people go to see those practitioners. And I'm just, for some reason, I'm blanking on the website that they can go to. I mean, I've done it and I certainly can do it, but I always say go to the experts who do it 24/7. But yes, it absolutely can help.
Wonderful. Uh, if there are any questions, feel free to keep putting them into the chat, or you can unmute yourself and then indicate to me that you do have a question. Let's see. Oh, next one. How do you go about, so we can come to you, but how do you find out who's a good acupuncturist or who's really, good at what they do?
Yeah, that's always the $1,000,000 question, right?
Mhm.
I think that what I always recommend people do is ask around, ask friends, because usually someone has seen somebody. If you just ask enough people, or they're like, oh, a friend of mine went to this person and that person. There is a website, it's called AcuFinder, ACU finder.com, that if you put in your zip code, it will come up with a list of acupuncturists. I would say if they've been in practice for a while, that usually means they're decent, because really only about a third of us make it in private practice. So if they've been good enough to make it, chances are they're pretty good at what they do. I mean, you always want to make sure they're licensed, and you can go to the California Acupuncture Board and look that up. But usually I would get a referral. I mean, word of mouth is how my practice grew. And so usually somebody knows somebody.
Wonderful, thank you. Next question. What herbal medicine do you recommend for anxiety and depression?
Again, there isn't just one stock formula, right? Because in Chinese medicine, the underlying mechanism of each individual's anxiety or depression, it can be different. And so then I would give different formulas depending on what that root cause is. The other thing too is that you shouldn't be buying herbal formulas off the internet. Like if I said, oh, Xiao Yao Wan or something is good, I wouldn't be buying it off the internet. You know what I mean? And you want to make sure that it's not interacting with anything else you're doing. And so that's why I said it's hard for me to just talk specifically about certain herbs or certain herbal formulas, because everyone's so different.
Wonderful, thank you. Are there any other questions at this time? Feel free to put them into the chat, or you can unmute yourself. And thank you so much, Dr. Painovich. I think
Yeah,
this
absolutely.
clears a lot of assumptions or ambiguity in terms of traditional Chinese medicine. Next question. Do you work with a lot of gut issues like bloating?
Absolutely. All the time. And I'm telling you that Chinese medicine is the best for gut issues. Like I can't say it enough. I just don't think there's anything better out there than the herbs and the acupuncture for gut issues. And a lot of it, and I do a lot of discussion with nutrition and foods and that type of thing, because so many people have food sensitivities that then lead to gut imbalances and that type of thing. Again, I have information on my website about that, but I always incorporate that in whenever I see patients.
You mentioned the website for AcuFinder. Do you
Mhm.
have one for Chinese herbal, for those who specialize in Chinese herbs?
No. So anyone that's is licensed in acupuncture. So it's that L.AC. That means that you've passed the board exam and you practice Chinese medicine, right? We get taught acupuncture and herbs within our schooling. Now, because herbs are really more the difficult part of our practice, not everybody does Chinese herbs. So if you call and make an appointment with someone, I would definitely say, do you use herbs as well? Because some people just don't, like it's too overwhelming for them to deal with. And they just use acupuncture in their practice. So you want to make sure that they do both acupuncture and herbology. And so there are no websites to say, oh, this person's a specialist. Like we all should be specialists. You know what I mean? Again, I guess you could Google. there's always Google.
True, thank you. Another question, for dealing with chemo symptoms, how frequently do you recommend treatment?
Yeah, it kind of depends on the symptom. At least once a week. The treatments are cumulative. So oftentimes I may want to see somebody twice a week for the first couple weeks to kind of get a handle on the symptoms. And then it depends. Like if the symptoms are reducing quite rapidly, then we'll go to once a week, once, every 2 weeks. So it really depends on how people are responding to both the acupuncture and herbs. And the other thing I can tell you, there's some really good formulas out there to take concurrently with chemo that really help reduce the side effects of the chemotherapy.
Thank you. Next question. What do you recommend for post-menopause symptoms such as hot flash, weight gain, hair loss, etc. after breast cancer lumpectomy? It is not recommended to resume natural hormone therapy.
Mhm. Yeah, so I treat that all the time. I treat women who are having hot flashes and all those symptoms because of, the medication they're on. So again, acupuncture works well. The herbs are a bomb when it comes to doing that. So it's usually a combination, and the herbs usually work really, really well.
Wonderful, thank you. We do have a couple more minutes if there are any last questions. Again, please feel free to put it into the chat or unmute yourself. All right, thank you so much, Dr. Painovich. This was really wonderful.
Absolutely. And, feel free to email me if you have questions and you weren't comfortable, speaking up in the group.